of course, once you know you're ovulating, there's a chance of pregnancy. But then it's very subjective. Some women can feel it, some women absolutely don't feel it. And it's not compulsory that every woman has to have this.
So apart from pregnancy, what are the other abnormalities that could happen in women if they do not ovulate?
Hormone का अनुकूल cycle can lead to cancers. अच्छा मुझे बच्चे नहीं चाहिए, मैं ऐसे ही छोड़ दूंगी, anovulatory cycles तो आ रहे, it can have some effects on your ovaries and your uterus.
Are there any side effects of this that the girl would go through if she starts getting like a hormonal treatment?
ऐसा नहीं कि कुछ भी दे दो, सालों साल तक दे दो, वैसा नहीं होता है. Can this cause cancers? Yes, theoretically they say that it could, but
Welcome to Voice It with Karishma Shah.
Hello, I am Karishma Shah. I'm the nutritionist and brand awareness executive. I'm here with Dr. Priti Challa today. She's a Gynec OB, and we're going to be talking about a very interesting topic today, which is ovulation. And Dr. Priti is going to help us with the different stages of ovulation and also some important information about how the process is and what it is that girls can do if they do not ovulate, and lots of other important information about ovulation and anovulation. So Dr. Priti, hello, thank you for joining us today.
Hi Krishna, how are you?
I'm good. So firstly, I would like to start with, can you please explain to us what the whole process or concept of ovulation is like?
Okay. Basically, see, Karishma, ovulation means release of the egg, as in you're making an egg. We are born, women are born with a certain number of eggs in our body, in our ovaries. So what happens is when these eggs are released every month, sometimes you have ovulatory cycles and sometimes you have an ovulatory cycle. Every time you release an egg, it's called an ovulatory cycle. So normally a release of the egg because of the set hormones in the body which are under control is called ovulation. This happens normally in the middle of the cycle.
Okay. And so usually when there is the ovulatory phase is going on, how is it so critical for a girl in her menstrual cycle to be ovulating? What is the importance of ovulation in the menstrual cycle?
One, ovulation, of course, once you know you're ovulating, there's a chance of pregnancy. So pregnancy chances are higher. And second point is when you are having an ovulatory cycle, that basically means your cycles are perfect. I won't say perfect, but at least we will know that ki hormones control mein hai. So you're releasing the right amount of hormones to have an egg release. And then if you get pregnant, then it continues as a pregnancy, and you don't get pregnant, the endometrium sheds. So there's no way, that is the importance of having an ovulatory cycle. That means ki hormones apne control mein hai and perfect hai abhi to.
Okay. And what are the usual symptoms like for a girl to know that now I am ovulating? This is my phase of ovulation.
Yeah. See, there are a few signs, but we have to understand ki ye signs na pakka nahi hote. Like how it is written in the textbook. There are something called a spin-Bakiti test, okay? During this time, that normally ovulation, we expect ovulation in a perfect cycle where the hormones are, under control and they're happening, exactly releasing on time. Ovulation happens between the 12th to the 18th day. And for some women, between the 10th to the 20th day. But normally 12th to 18th day is when ovulation normally occurs. So during this time, women normally normally signs where your white discharge increases. And then this white discharge, when it's placed and you try to, it's a little sticky. This helps the sperm to go and meet the egg. This is exactly why the white discharge increases, the clear discharge. And when you put it between two slides and pull it apart, and it has a little spin-Bakiti kind of feel to it. And second, you'll feel some breast tenderness or heaviness in the breast. And some women do have something called as mid-cycle bleed. This is mostly, this occurs during the ovulation time, where some women bleed during this time. They might have spotting for 2-3 days, and then it's normal, and you get your periods on time. And these are some of the signs that you have. You can say that you're ovulating, but then it's very subjective. Some women can feel it, some women absolutely don't feel it, and it's not compulsory that every woman has to have this. And just because these signs are not there doesn't mean that the woman is not ovulating. And of course, there are also ovulatory kits, but we have to remember that these ovulatory strips have to be done 12 hours apart, every day to 12 hours, every 12 hours apart. ये नहीं कि दिन में एक बार कर लिए बस हो गया, नहीं. We have to do this 12 hours apart. So that means in a day you do it twice during the ovulation time.
Okay. So, doctor, you mentioned that, just because we don't have these symptoms doesn't mean that we're not ovulating. So,
Right.
will you be able to help us with how is it that I can come to know that, or somebody else can come to know that they're not ovulating? How can you explain the anovulation phase, please?
See, it's very difficult to say. One, normally when they're ovulating, they in an anovulatory cycle, it's very difficult to say. This happens, a woman comes up and then finds out she's anovulating is when she's trying to conceive and it doesn't happen. And normally anovulatory cycles are a little irregular.
Okay.
They're not on time. And when I say on time, it has to be somewhere from the 24th day. You have to get your period from 24 to 40 days. Beech mein aa jana chahiye period. Or you can even stretch it to 45 days. But some people have regular cycles, but they could be anovulatory. How do you know? Only when they plan for a pregnancy. There is no telltale signs that, aisa hua to anovulatory hai. Normally, in my experience, what I see with some patients, some women who come, most of them have painless periods. And when the periods are pain-free, we assume that they are anovulatory also. They could be anovulatory also. But you can always do a strip test, like the ovulatory strip test, to check if you're ovulating or not. When you are ovulating between those 10th day to the 20th or 12th to the 18th day, in a regular 28 to 30 day cycle, when you're ovulating, this is when you have unprotected sex. But there are some women that the egg releases a little early or a little later also. I'm again saying the ovulatory dates that I am saying is mostly for people who have the perfect 30 days, 28 to 30 day cycle. So really speaking, there is no telltale sign ki acha ye anovulatory cycle hi hoga. There's nothing like that. See, normally when you take OCPs, you take a contraceptive pill, that is what happens. That's how you don't get pregnant, because it makes you anovulate. It saves your eggs.
Yes.
Or in polycystic ovaries, most of the time the eggs are not released. So that's when you know that you
So, doctor, also, when someone is going through, if they know that probably they are in a phase where the anovulation is happening, they're usually not getting their periods on time. And the other symptoms that you mentioned that usually happens, maybe they do have painless periods and everything. So apart from pregnancy, what are the other abnormalities that could happen in women if they do not ovulate?
Not really speaking, if ovulation not ovulating will not cause a major effect on the human body, on the women's body, but irregular cycles can. When you have irregular cycles, what you have to understand is because of the like say you're not getting your periods for like 3-4 months or chhod diya, then haan jab aayega dekha jayega or something like that. Vaisa, when something like that happens, we have to understand कि because of the unopposed action of estrogen. See, अपने periods तो आ रहे हैं क्योंकि आपके hormones release हो रहे हैं, and because each hormone has to be counteracted by another hormone. So if one hormone is going on secreted and the counteraction of another hormone is not there, so this unopposed action on the uterus, hormone ka unopposed action, can lead to cancers.
Okay.
So that is something we have to be very careful about. So if you're having anovulatory cycles, infertility is the major side effect of it. And secondly, we have to make sure we rule out cancers later on in life. So you have to make sure that you have regular cycles.
Yes.
So anovulation has to be checked. So that's exactly why we always say, please go for a yearly checkup. Go for a yearly scan. So we know if you're developing polycystic ovaries or anything like that. Anovulatory cycles are not something you should take light. अच्छा मुझे बच्चे नहीं चाहिए, मैं ऐसे ही छोड़ दूंगी, anovulatory cycles तो आ रहे. It can have some effects on your ovaries and your uterus later on also.
Okay. And what is the best way to check ovulation for girls currently? The most easiest way that you would recommend?
The ovulatory strips. And we have to understand that these strips have to be checked for every 12 hours during the ovulation period that I had mentioned.
Okay.
Agar you don't see ovulation, once the egg releases, normally lasts anywhere between 22 hours to 48 hours. And sometimes a little more also. We have seen women where the ovulation, the egg stays in the body for a longer time, probably even 3 days. So anytime from 1 day to about 3 days, the egg will stay there, hoping that the sperm is going to come and fertilize it. If it doesn't, then it sheds along with the endometrium. So during this time, we have to just do a strip test to see if you're ovulating or not. But then we also have to understand the strip test, nothing is 100%. Everything has a little bit of a false positive and false negative also.
And these strips
so
are
these
available
are the only
over
best
the
tests.
counter?
And of course, yes. And of course, like the textbook says, 8 degree, 0.5 degree temperature rise hoga body pe during the ovulation time. Breast tenderness will be there. Excess mucoid clear discharge from the vagina can be there. These are, or minimal bleeding during during the ovulation time. These are the signs that textbook says it, but it's very subjective.
Okay. And what are the usual signs? Like, what is the usual mode of treatment? So if there was somebody who came to you, one of your clients came to you and they said that I'm not ovulating, I would like to start the process. Probably I would like to conceive, or even if I do not want to conceive, I want to start the ovulation phase again in my menstrual cycle. What would be the most common method of treatment from your side?
See, first and foremost, we always tell patients, don't be in a hurry to start off infertility treatment unless you really, of course, age matters. You can't tell a 40-year-old ki chalo ek saal ruko, but normally you have to wait for a year of unprotected intercourse happening, and you're meeting on the perfect ovulation days. Wait for a year. If it doesn't work, and if it does, you don't get pregnant in that 1 year, then we plan for ovulation induction. Okay, ovulation induction matlab, first we do a few tests to see why this is happening. Any hormones are high or low, why it has to actually happen. And then we try to set right the hormones by giving you tablets. And then we, like say for example, somebody has polycystic ovaries and they're not ovulating, but they're having their cycles on time. Then what we do, we try to give them a very low dose hormones, which is perfect for their weight. We check their weight. We try to figure out first what the problem is, and then we give them hormones so that it helps in egg release, helps in increasing the discharge, so that it helps the egg and the sperm meet, like the clear discharge I told you about.
Yes.
So it will be a month's course of tablets.
Okay.
And they have to follow that. And then you do a scan during those ovulation days to check, an alternate day scan to check ki agar egg form ho raha ki nahi. So basically it's giving them some minimal hormones and minimal chemicals in medicated form, so that we kind of push the ovaries to develop eggs, giving it that little push. Obviously hormones come here, so we increase the hormones in the body to a normal level so that they get their egg out.
Okay. And what are there any side effects of this that the girl would go through if she starts getting like a hormonal treatment?
See, there are not really major, unless this is done under well-trained doctors who handle ovulation and who handle infertility treatment, because there is a dosage that has to be given. ऐसा नहीं कि कुछ भी दे दो, सालों साल तक दे दो, वैसा नहीं होता है. You always have to give a break also in between. And I think nowadays, not nowadays, for a while now, doctors give a good break, and they tell them to try also naturally, because this hormone effect lasts for a little bit. Okay, we can always give a gap. So we tell patients to try continuously for a little while, give it a break, and then come back again. And with the evolving medicine, if pharma companies evolving such amazing medicines nowadays with injectables and all, and technology improving so much, infertility success rates are so high now.
Yes.
So what you should be worried about, and also every infertility doctor, when a patient is taking treatment for a long term, they always check up on their uterus, they always check up on their ovaries, like make sure that they're not having any side effects. Normally you see something called as ovarian hyperstimulatory syndrome, OHSS. This is very common when people are taking infertility treatment with certain injections, but that is something that can be observed in a hospital. They keep you on observation so that it reduces on its own, and there's only supportive treatment for that. Can this cause cancers? Yes, theoretically they say that it could, but there are very few cases that have been seen in studies which have ended up with cancers.
Okay. And if there was someone who did not want to, if they came to you and they told you that I don't want to get onto the hormonal pills, or I don't want to start the hormonal therapy, but maybe I could do something in my lifestyle change, maybe I could do some kind of a personal change and it could help. So do you think that maybe lifestyle modification could help?
See, like I told you, we tell them to try for 1 year before they plan pregnancy.
Yes.
So in this 1 year, we give them a lot of lifestyle changes. Like we ask them to avoid smoking, avoid alcohol to an extent. We ask even the husbands to avoid alcohol, smoking, and recreational drugs, and exercise regularly, because exercise is not just for infertility treatment, but generally helps in keeping your hormones under control to a good extent. And have try to avoid sedentary lifestyle, and have a good diet program. This has to be done before you start the ovulatory treatment. This is the regular routine. And some women on the heavier side who develop polycystic ovaries, with a higher BMI, and develop a polycystic ovaries, normally 90% of the treatment to have ovulation in polycystic ovaries and reduce the polycystic ovary effect on your body is exercise, is weight loss. I wouldn't say really weight loss, but I would say more of exercise and a healthy lifestyle.
Yes.
You could lose even 1 kilo and have like superb cycles and plan a pregnancy immediately and get conceived, and you can conceive. But some women might lose even 18 to 20 kilos, and then they will still require that push. Like I said, this is very subjective. Each patient is unique. Each patient's ovaries are very unique. And the number of eggs they are born with. Each one could be born with 1 million eggs, or about 10 million, 20 million eggs, or even just 1 million eggs. So it's how fast they use those eggs. And can you know how you can find out how many eggs you have? There's really no way of finding out as of now. Or as of how much I know, my knowledge, I don't think there is anything to find out. 10 million eggs, 10 million eggs. Maybe there is, but something I'm not very clear about.
Okay. And thank you for telling us about the lifestyle changes. But if there was somebody who did these lifestyle changes and they were planning to start conceiving now, would you be able to tell us any particular window for them, which is like a fertile window, and they could plan their conception at that period of their menstrual cycle?
Yes. See, I'm telling this for somebody who has a regular 28 to 32 day cycle.
Yes.
12th day to the 18th day. Sometime during this time, that is considering day 1 of your period is day 1. The day you get your period is the first day. You have to count that as day 1.
Yes.
And then from that day, from the 12th day to the 18th day, during this time is when having unprotected intercourse will help in pregnancy, provided you have sexual activity every day. Some doctors say that every alternate day, but I'm a little particular that they have sexual activity every day, because I have seen that in some women, the egg lasts only for 22 hours. So I tell them to have sexual activity, unprotected sexual activity every day from the 12th day to the 18th day, in a blind, assuming that we are blindly following that the woman and the man, the partner, are normal. And we're inducing some kind of hormones for them. Otherwise, you do a scan during this ovulatory time, scans, and you then make sure ki acha theek hai, egg release ho raha hai, please have unprotected sex today or tomorrow, unprotected intercourse today or tomorrow. You'll know by looking at the scan ki acha aaj to release ho gaya egg, chalo, you have to have unprotected intercourse today. Or you go, in case the partner is not available, which we might know a little ahead of time. And then we because that happens, when somebody's in the army or something like that, and they are unable to be there on that particular day. So we make sure that unka semen hai, and then we wash the semen, take it, and something called as IUI, where we insert it into the women's cervix.
Okay. Thank you for all this information. And lastly, just one last question that I would like to ask you. You've gone through so many, cases in your career and everything. Would you want to share some tips or tricks for people who, for girls who actually want to start conceiving now, and, if they feel that the ovulation cycle is working fine and they want to conceive, do you think as a professional there would be something that could actually add to their process?
Yes. First and foremost, don't stress about it. It's absolutely okay. There's a lot of technology. If you want it, it will happen. Just don't stress about it. And I would like to say, don't have intercourse to just plan a pregnancy. Have it because you are together in this union, your partner and you are in this together. But it will happen. No stressing out at all. Avoid alcohol. Avoid an unhealthy lifestyle when you're planning pregnancy. Both partners. This goes for both. Not just because she's planning a pregnancy, because the sperms also slow down and might not be up to the mark to meet the egg if you're under alcohol, under certain kind of influence of certain kind of drugs. And recreational drugs have to be completely avoided. And that also means that there's no wine for women or men during the time that you plan sexual activity. Lifestyle changes have to be there. And then I would like to tell women to start off on folic acid even before you, from the time you plan conception, because that is something which will really help in having a healthy pregnancy, a healthy fetus.
Okay. Thank you, Dr. Priti, for all this, very, very informative and very important information for all the girls who would now, get so much information about their ovulation cycle. And if they are not ovulating, they'll know what they could do to start the ovulation process and the conception process. Thank you for being with me in this interview.
My pleasure.
Thank you so much.
Bye-bye.
Bye-bye.